Gus Birkhead. I'm a faculty member at the School of Public Health at the University of Albany. And I come to the School of Public Health really through the State Health Department. We have a unique relationship here for a School of Public Health that has a very close tie to a State Health Department. So actually I spent most of my career in the State Health Department, but as a faculty member. And when I retired from the Health Department, I stayed on as a faculty member here at the school. So despite the fact that I spent a lot of my career at the Health Department, I feel like I've had an international flavor always to what I've done. Even growing up, I lived overseas for about 4 years in Turkey and Pakistan. So I feel like I have a sense that there's a bigger world out there, and the concerns of the United States are not the only things that concern people. At the State Health Department, I part of the time directed the AIDS Institute, and we had quite a collaborative relationship going on with Puerto Rico and areas in the Caribbean, because New York City particularly is such an area where people come from the Caribbean and go back, and we had HIV patients who needed to have continuity of their medical care and other things. So we had relationships with healthcare providers and researchers in Puerto Rico and elsewhere in the Caribbean. So even working at a state health department in New York particularly, you can't escape the wider world out there. It's said in New York City, every language in the world is spoken. And so we have to have an international view to public health, even in New York, even in the United States. Well, let me say a little bit about my international work. Other than at the State Health Department, obviously we'd had these HIV relationships around HIV issues. But as a professor at the university, I also have mentored students from Eastern Europe, in particular through the Fogarty program, and with a particular focus on HIV. And I've traveled to Poland and the Czech Republic to give talks with Dr. Dehovitz and the other folks on the Fogarty team. And in that course of that, both working with students and traveling, have discussed projects around HIV. I think we tend to feel in the US, oh, we know everything, but we don't. And there's a lot for us to learn from working with the researchers in other parts of the world. We have many common problems, injection drug use, stigma against HIV, other things that we struggle with here, and it's good to get other people's viewpoints on that and to understand how they might approach a problem. Gives us some ideas about how we might do things. And then working with students here who are from Eastern Europe, I need to be sure that they have some data from their home country to use. Mostly these are master's students, so I work with them as soon as they get here to get data from their country that they can use for their master's project, and then help work through the analysis of those data with them. But in the process, I learn a lot about their system, their health system, and also the kinds of data that they're collecting and the issues they're facing. So that's really important for us here to learn those things as well, and what they do informs as much what we do as we teach them. I think sometimes that's the way it ends up.